Hey guys, it's Dr. Justin Marchegiani here. Happy Friday. Hope everyone's having a fabulous day. We're going to dive in and do a live video on coronavirus updates for the week. Put your comments down below if you're dealing with any health issues or curious about the coronavirus. Let me know. Really want to know what you guys are thinking. All right, so let's dive in. Where are we at in coronavirus world? So, the statistics are getting a little bit muddled because the diagnosis criteria is pretty darn wide, right? There's a difference between dying with something and dying of something. And the diagnosis that's currently laid out, let's just say, is providing a little bit more latitude for people that get diagnosed with it to get lumped into the death rate. We know Dr. Birx on the White House press conference said that, hey, if you die with it and you die of kidney failure, but you die with the COVID-19, we're going to classify you as a COVID-19 death. She said that. She said the diagnosis criteria will be very liberal. So we know that. So it's good to take that into our account when we look at everything. So we have a good filter. Context is everything. If we have some good context here, you guys are going to have some good comfort. We want to look at context and precedent so we know what direction we're heading in, right? This is knowledge guided by experience here. I'm going to try to lay out what is happening for y'all. So first off, these are my stats that I've been laying out, kind of keeping track of the whole incident. We have a couple of things to highlight here. So number one, we have the CDC stats, which lag by about a couple of weeks, about a week or two, they say, right? So we see the 47,128. These are more on the confirmed side. And this is updated today, May 8th. If we go to Worldometer, we're going to see a different story here, okay? We're going to see a different number of deaths. We're going to see 78,492. Now, I think these aren't confirmed, okay? So obviously, you go from 78,492 all the way to 47,128. That's about a 31,000 difference. So there's a big gap there in what the CDC is saying. And again, they kind of give you a little spiel down at the bottom about why that is. And it's about a 1 to 2 week gap, right? Provisional numbers here, it talks about it, and they say their counts track 1 to 2 weeks behind. Is there enough? Would 31,000 people come up in the next 1 to 2 weeks? I don't know. I'm not sure. So I'm just skeptical. I'm just trying to use my common sense here and look at discrepancies and just kind of walk everyone here through my thinking so you guys can get in my little head. All right, so numbers here. So these are the numbers I put in, 47,123 confirmed by CDC. So when we look at mortality rate, it's small number over big number, okay? Small number over big number. So there's always going to be less deaths than there are cases. That's just common sense. 1.318 million cases, 47,000 confirmed deaths. That's a mortality rate of 3.56%. This is hysteria math because this number on the cases is always bigger. The data is saying it's 10 to 50x bigger. Some studies say 80x bigger, okay? So when we know the cases could be 10 to 50x bigger, that takes the mortality rate from 3.58 to 0.36, or if 50x bigger, we'll take it down to 0.01, less than flu. So just kind of giving you the hysteria versus the real, and same thing with the world math, same 275 on the world. I couldn't get like a CDC equivalent to this, sorry. 4 million cases, and then you're going to see 6.88%, and then down to 0.69 to 0.01. Again, same here. And again, the original estimate was by Dr. Tedros of the WHO, said 3.4% mortality rate. And if that was the estimate, well, if we're at a 10 or 50x rate, we're at 9 to 475 times off. And then worldwide, 4.9 to 247 times off. So we just kind of want a reference for all the craziness that happened. All that craziness kind of started with a 3.4% death rate. So we want to know what's our reference point, and then how far are we off from that reference point. So if we see that 50x is correct as the data is starting to show, then that kind of shows we're really kind of far off the mark. So I'll kind of tell my story there in a second. And then here's flu. So this flu season was supposed to be a bad one. Okay, I'm going to just lay it out for you guys. Where is it? Right here. Let me get you my flu number. So this flu season should have been bad. 2019, 2020, especially severe, CDC suggests. And again, this is in January, okay? That's January. So the flu numbers, it's hard. I wish they had it all here. Typically this season average is 36,000. Again, this is from, I think, February 1st is only 6,000. So the flu seems to be down. Again, flu season starts kind of October, November, but most are going to die January, February, March. So this number does seem excessively low for me. So I wonder if some of these deaths got lumped in over here. Hard to know. I want to see what the rest of the season looks like. Just not sure on that. All right, so let me go over here again. So flu works out, 25,000 deaths on average this time of year, 250,000 confirmed cases. Then they do 1.2 million tests. They extrapolate the testing of 1.2 million people to how many total people got the flu. It ranges between 24 to 40 million. And again, if you do the 25 over 250, that gets you a 10% number. Oh, hysteria. But then when you do it over the bigger number, it goes down lower. So we got to know that this case number always is bigger. We don't ever look at it for what it is off the bat. We look at it for what it more than likely will be based on precedence. Does that make sense? Hope it does. All right, let me continue to show you guys some of the data in the news. So my big concern is you flatten the curve, right? You lengthen the amount of duration the virus is going to be around. The virus is going to work its way through. The only way you won't get exposed to it is if you literally stay quarantined 24/7. But even that, I think it was on CNN the other night. I think it was a New York study. Chris Cuomo talked about it. 60% of all people that were fully quarantined actually got the virus, and it was the largest group. So there's something to be said for getting out, being out, getting air in, exposing your immune system, maybe still keeping some social distancing, but the largest group was that quarantine group. So that is concerning. Studies show the highest mortality people had the lowest amount of vitamin D. Again, correlation or causation. We know vitamin D has major immune benefits with vitamin D. And helping the upper respiratory tract. So that's kind of a big thing. We want to keep that in the back of our head. So you guys should understand the hysteria math versus the real math. Now, if we compress, the more we lengthen this thing out, the more it takes us longer time to reach herd immunity, right? According to MMR studies with measles in Boston in the 1940s, there was about 58-60% of the population hits herd immunity at around that level. So I get an infection. I get COVID, or the virus is SARS-2-CoV, right? The infection's COVID-19. Weird, I know. I get this virus. I'm infectious for on average 2 weeks. After that 2-week point, some data says 4 weeks, but on average 2 weeks, now I have antibodies and I'm protected for a very long time. How long? Definitely years. Is it a lifetime? Who knows, right? But we know we're definitely have protection for a long time based on natural passive immunity studies and testing antibody titers and other conditions. We know it's a while, okay? How long, we're not sure. So once I get exposed to it again, I'm no longer going to get the infection because my adaptive immune system is on high alert, number one. And number two, I'm not going to be infectious. So I can be exposed to it and I can't pass that infection to someone else. So when we look at the data, we know the people that are getting hit the hardest are the elderly folk, especially people with comorbidity. Let me see if I can pull up the Italian study for y'all. That'd be awesome if I can find it. I had it here just a minute ago. Let me see if I can find it. Okay, good. So this is really interesting. I showed this the other day. I wanted to hit this home. This should make a really good point. So off the bat, so we look at SARS-2-CoV, right? Average age of death is about 80-81. That's important. So average age is 80-81. And then we look at the men versus the women. About 2/3 were men. Just FYI, and you can see almost all the deaths here are after 60 years old, about 95% after the age of 60. Now let's look at pre-existing conditions. Now the key thing to highlight here is, look at this, 3 or more comorbidities. This is 61% had 3 or more comorbidities. This is important. And if we look at the people that were younger, you're not seeing any statistical significance here. So I'm just trying to, do a pushback. This is me pushing back on the virulence, how strong this disease is, this virus is. I am saying it's not. Based on the data, it's not that strong. Now, I think the biggest discrepancy, it is not responding to ventilators like flu typically would. This is the big issue, about a 10% survival rate on a ventilator. So you should probably look for alternative if you're going to be in that position. I've done videos on other alternative things like hyperbaric, oxygen, IV vitamin C, antibody therapy, where you take people that have already been sick, no longer infectious, spin out the plasma, give them the antibodies, high dose vitamin C, blood transfusion, because the hemoglobin tends to get destroyed by the virus. Of course, the Plaquenil or the hydroxychloroquine with the azithromycin, and the zinc. The zinc is important. The Plaquenil or the the Plaquenil or the hydroxychloroquine is an ionophore for zinc. It helps get the zinc into the cell, which triggers the virus to die. This is very important. Just kind of looking at the data, want to lay it out for you guys who the infectious group is and why, and just trying to give you a couple of different mechanisms and way to think about it, okay? Let me go back to my data here so you guys can see a little bit more. So we talked about the average age, 60 and up, 95% of people. 2 out of 3 are men. And the data shows here this is 3 or more comorbidities. And this is out of an article, I think, in Italy. Characteristics of SARS-2 based on available data, April 23rd. So this is Istituto Superiore di Santé. So it's some medical organization in Italy. Okay, that's where I got it from. All right, so you guys can look at it right there. I'll try to put the link below the video so you guys can dissect it all. All right, so my big concerns. I've already talked about it before. Here's the CDC documentation on this thing. Let me break it all down for you. Here are all the deaths, 47,128 deaths. My big concern was on the diagnostic codes. Let's look at the diagnostic codes again. There's 2 diagnostic codes, U07.1 and U07.2. Let's go look at that. Okay, U07.1, this is for coronavirus infection, severe, acute, unspecified, right? This is U07.1. It excludes these things. This is COVID-19. Then there's U07.2, which is for clinical or epidemiological purposes where a lab confirmation is inconclusive or not available. So this is the U07.2. So U07.2 is not in this data here. Okay, it's not in this data here. Where'd it go? Okay, I got to scroll up. Okay, so U07.2 is not here. Just want to highlight that for y'all. Now, my big concern is with the U07.1 data, look, they are including people that have not had a confirmed diagnosis. So let me go highlight this for you. All right. COVID-19 deaths are identified as using the ICD-10 code when COVID-19 is reported as a cause of death, or when it's listed as probable or presumed, the death is coded U07.1. And this can include cases with or without laboratory confirmation. Now, I don't understand what the point of that is, because don't we have U07.2 where laboratory confirmation is inconclusive or not available? So I don't understand why we have 2 diagnoses that are subjective. I mean, I understand having one diagnosis that's objective, right? And then you have this one over here that's more subjective, but based on what I'm seeing here, U07.2 is subjective, meaning if you have upper respiratory symptoms and no confirmed lab test, that can be considered positive. But then we also have it over here, right? U07.1 can include cases with or without laboratory confirmation that is probable or presumed. That means any upper respiratory tract symptoms, you can be lumped with that. So now that's directly from the CDC. So I don't want to take things out of left field or right field. I want to use actual data so you guys can see. So my concern is some of the diagnostic codes that are being used right now, they're of a subjective nature. So this can inflate some of the data. So I want to look at some of the antibody testing for you guys so you can see. This gives us a kind of a mindset that we're walking in the direction of more herd immunity. And herd immunity is the best way that we can get over this. Once I'm infectious for 2 weeks, I can't pass that infection around like a hot potato after I've been infectious for 2 weeks and I have antibodies. So a couple of studies here. Number 1, Virginia is seeing a jump in COVID-19 testing. The problem is, I can't believe this. One person is tested 3 times. All 3 tests come back positive. It counts as 3 instead of how the numbers are being counted before. So like normally if I'm one person, I test positive, right? That goes as a positive case. Now if I test 3 times, I'm counted as 3 cases. So this is some of the reason why the data could be up. This is on NBC, why Virginia may be seeing let me share with y'all, why Virginia may be seeing a jump in COVID-19 cases. This is on NBC News on May 1st. Let's look at another article here. This is out of Reuters, okay? They're just looking at the Correctional Institute here. 4 U.S. state prisons, they tested 3,300 inmates who tested positive for coronavirus, 96% without symptoms. 96% of 3,300 patients who were infectious were asymptomatic. This is good. This gets us closer to herd immunity, right? So if someone tells you that you have a chance of getting infected, and 96% of the time that infection will show no symptoms, do you think this infection is virulent, strong, or a little bit weaker? Right? I'm going to lean more on the weaker side. Let's go look at this is in Kansas City. More than 370 workers at a pork plant in Missouri test positive for coronavirus, right? Interesting article. That's what they lead with. And the first sentence in the article was, all of them were asymptomatic. 100% out of the 370 workers were asymptomatic. Well, why didn't they lead with that? I mean, seriously, you say 370 people got this infection, 100% are asymptomatic. That's a big deal, right? That means herd immunity is working its way through. USC study, right? This is looking at the LA area. Estimates that 28 to 55 times the amount of people will have antibodies for this infection. The estimate is 28 to 55 times higher than the 7,900 people confirmed with COVID-19. And again, if you're looking at Facebook, guys, I have all these articles on the screen on the YouTube channel going live right now. That's USC. We have Science Magazine. This is at Stanford, I think. They say that's more than 50 times as many as viral gene tests had confirmed and implied a low fatality rate, a reason to consider whether the strict lockdowns are worthwhile. That's sciencemagazine.org, looking at the Santa Clara area. Next, we have The Guardian. The Guardian is looking at this is actually looking at the Bay Area. The previous study was looking at, I'm not sure what area that was. Oh, that was looking at Germany and Netherlands. That was Germany and Netherlands. And this study here is looking at the Bay Area. At the high end, that would mean the case count in the county at the time of the study was 85 times higher than the record case count. So this is why I'm looking at an asymptomatic rate 50x, all right? And this is like knowledge guided by experience, right? You go back to 2009, go in the time machine. What did the swine flu have to get revised down to? It had to get revised down 65 times because they underestimated the amount of cases 65x. What does that mean? They made it 65 times worse than what it seemed. So when we have that data and then we kind of fast forward today and we look at the antibody data that's coming out, it gives us reason to pause and gives us a little bit of comfort that this virus may not be fully what it seems on the virulent side. Hope that makes sense for you guys. And then this is where I grew up here in Boston area. 1/3 of 200 Chelsea residents that gave blood, 1/3 of them had antibodies. 1/3. Okay, 2% death rate. So that's about a 20x, 15x on the antibody side. That's pretty good. So I just wanted to highlight that for you guys. And let's go look at where we're at here today. Trend is still dropping on Worldometer. Let me go watch the cases for you guys so you can see the trends here. I like to compare us to Italy. Italy was about 2 weeks ahead of us. Okay, that's the world. That's the world there. Let me go to the United States. So we can see the cases are starting to drop. There's always about a 2 to 3 week lag time on the cases to death, right? The average COVID-19 patient, 2 to 3 weeks pass from the diagnosis. So you can see the cases are steadily dropping at about a 10% drop there. And then on the death side, you can see the deaths are still dropping. We had a really good Monday, Tuesday, a big spike the last 2-3 days. And again, there is going to be an overlap. Like I showed you, the flu from February to now, only 6,000 deaths. According to Time Magazine, this was supposed to be a big flu season. Are there flu deaths getting lumped in with COVID-19? It may happen. It may be the case. Let's look at Italy, right? Look at daily deaths from Italy. They're dropping. Remember, they were really high up. And look at their cases as well. They're also heading down as well. So this is the general kind of parabolic curve that we're going to be heading through. It's just a matter of time. The more people that get an exposure to the infection that are not in that high risk section are going to get antibodies. Those antibodies will be protective. And the conversation I'm trying to switch to is, instead of a defensive medicine approach, which is washing your hands and socially distancing and quarantining if necessary, right? What about an offensive approach? What about vitamin A? What about vitamin D? What about zinc? What about keeping your carbohydrates in check, right? These are going to be things that are going to really, really, really help your immune system and keep your immune system stronger. And a stronger immune system, a better antigen, antibody, adaptive immune system, the better chance that you're going to be in that asymptomatic category. You're going to make antibodies and you're going to be protective for a very, very, very long time. Let's look at the data again here, guys. So there's Italy there. Let's go look at UK. The cases are still a little bit flat, but they're still trending down in the UK. And then you can see here overall the deaths with the UK are all dropping as well. Here are the deaths. They're all heading down just like this. Same thing with Netherlands. Let's go look at Netherlands. So cases are really dropped in the Netherlands. And then cases are really, and the deaths are also dropping as well. The biggest thing, about 50 to 60% of all of our deaths come from 3 states, right? Massachusetts, New Jersey, and New York. Why is that? The biggest factor, according to a study at MIT, is public transportation. That is the biggest factor. Let me pull up that study if I can find it. Here we go. The subway seeded the massive coronavirus epidemic in New York, right? And of course, then people from New York left to New Jersey, or a lot of them commute from New Jersey to New York, right? And maybe even Connecticut. So you can see this is the biggest connection here was the subway system. So just trying to draw that out for you guys. Hope you enjoy it. What's the big take home here? Take home is understand there's a lot of hype and hysteria out there. Antibodies show this is a much, let's say, less virulent virus. Now people get scared. Oh, it's out there. It's everyone. Hey, if it's out there, people are making antibodies. We're going to hit a critical mass at about 60% where this infection is far harder to pass around. We know the data on UVC light and viruses, right? Typically 75 degrees, 40% humidity. A virus lasts about 1 minute out there. So it's way harder to get this thing outside. So start getting outside if you can, where you're at legally, unless you're at a high risk, mortality, comorbidity issue. Still try to get some sunlight, get some fresh air. I think it's really good for y'all. All right, any questions, feel free to let me know. I'm going to chime in on the live Q&A here. Let's see what is happening. Spivey writes in, hey everyone, hope all is well. Things are going good here. That's a lot of open tabs. Yeah, I basically collect them during the week. I just keep my monitor open and I just find articles and I just stash them up. And then I'm like, all right, I got enough to do a video. I believe the numbers are totally exaggerated. They are. I mean, they have to be exaggerated based on the diagnostic criteria. Think about it. If we diagnose flu the way we're diagnosing COVID-19, we'd probably have a flu death rate that would be exponentially higher than it is now. Western countries are doing bad and third world countries are doing well. I know. It's kind of interesting how that is, right? It really is. Yeah, vitamin D is the most important to fight inflammation and the virus. Yeah, I'm going to say vitamin A. You can get this from cod liver oil and your polyphenols and your vegetables. Again, you'll get beta carotene that you'll convert over, but vitamin A and cod liver is even better. Your vitamin C is going to be excellent. High quality ascorbate with bioflavonoids and buffered minerals is great. Your vitamin D, I would do 5 or 10,000 IUs per day, unless you know where your levels are at. And then I would do glutathione or NAC to really keep your redox pathways up in your lungs. And your redox pathways are the antioxidants that give off electrons that stabilize that inflammation in your lungs. And it keeps your superoxide dismutase up. And your superoxide dismutase is a natural disinfectant, right? It's produced by your lungs as a disinfectant to actually kill off viruses and bacteria, which is pretty cool. Let me keep on rolling with you guys. Any advice for patients who are over 65? Get out every day in the garden. Yeah, I think get out in the garden, right? I mean, I think being outside, I think the idea of quarantining where you're inside may not be the best idea. Maybe be outside alone. If you have a garden, get some sunlight, get some fresh air, get some vitamin D, ground, get some water. If you got access to a pool, get in the water, do all that good stuff. I think that's phenomenal. And vitamin D and all your nutrients. Again, people that have diabetes and multiple comorbidities, this is a really good time to work on your food intake. Get on a really good whole food paleo template and get your vitamin D up for sure. Again, my stack would be right now A, D, C, glutathione. I like that. All right. It's a vascular thrombosis issue, not a lung issue. Yeah, so what's happening is a lot of clotting from the inflammation as well. So they're saying maybe being on a low-dose aspirin may also help from a blood thinning effect because of the clots that happen due to the platelets aggregating, so to speak. Yep. Yep, zinc's great as well. I had a friend that had pneumonia months ago, got better with antibiotics, but major sinus congestion remained. Did nasal rinses, ginger glutathione, slowly starting to cough again. Diet's in check, low sugar carb, great. Glad he's getting better. Worried about fighting off COVID in the States. Yep, do all the things that I'm mentioning right now. It's going to help a ton. That really will be. How much generally are the antibody tests? I am selling them for my patients for $170, and that includes IgG and IgM. And I saw someone's bill, and I can get the actual PCR test for the COVID, and it was like $170 as well for the PCR test. I saw someone's bill from their insurance company that didn't cover the COVID test. It was $3,000. You want to know why healthcare is so expensive? Is you got too many people between the doctor and the patient making money. All right, that test has a very tiny markup, and the fact that some insurance company is charging someone like what, 30, 35 times the amount? That's craziness. I mean, that's just fraud. All right, very good. Increasing vitamin C to 4,000 to 8,000, that's great. Yeah, with vitamin C, go up to bowel tolerance, right? Taper it up till your stools get loose and then back off when they solidify. Then you're at your optimal level. Zinc and quercetin are great. Yeah, the quercetin will really help modulate the inflammasomes that tend to happen due to a cytokine storm. So you have, various like lipopolysaccharides that are increased due to the cytokine storm because your immune system overreacts. And then you have these toll-like receptors and these inflammasomes, which are like these inflammatory immune byproducts. And things like quercetin can actually modulate that and kind of balance it out, which is really good. 100% are asymptomatic, shaking my head. Yeah, I know. It's crazy. It's totally crazy. I mean, someone says, hey, you're going to get something and you're going to get a 95% chance of being asymptomatic. I think most people just turning on the everyday news would probably think they have a 95% chance of dying, let alone a 95% chance of being asymptomatic. And I don't even know if people know what that means. I mean, I kind of assume, right? But asymptomatic means you develop all the antibodies and the immune response. You're going to be resistant to it for a very long time, and you didn't get sick. It's a double whammy. It's awesome. Let me skip over to Facebook. Hey, Steve, hope you're doing well. If you take zinc, must you take it with copper? I'm not worried about it right now being at a high copper level right now. This is natural zinc and copper ratio. But take an extra 20 or 30 milligrams of zinc a day. All your high paleo foods in zinc are also going to be very, very high in copper as well. All your grass-fed meat, all your seafood, your pumpkin seeds, your green vegetables, your fish, they all have a very high zinc and a very high amount of copper. You don't need much copper though. A couple milligrams, you're good. But if you want to take a tiny bit with it, that's fine. I'm not too worried about it. 20 milligrams of a zinc aspartate, picolinate, glycinate, all those are fine. Okay, great. Gargling with sea salt water apparently reduces risk of COVID infection. Any insight? Well, I mean, that's great. You can do hydrogen peroxide too. Hydrogen peroxide's awesome, and it kills the virus in 30 or 1 minute. Everybody's been telling me we need a vaccine for herd immunity. Nothing to do with it. Yeah, so, I mean, your best way for herd immunity, the problem with the vaccine is going to be the fact that we don't know how effective it will be in producing antibodies, right? But we do know, and how long will those antibodies last? But we do know with natural passive immunity, which is, you get chickenpox, and then you don't ever get chickenpox again. We know that lasts a lifetime, or at least a very long time, 50 years or so. Chickenpox can morph into shingles as you get in your 70s or 80s. Chickenpox is natural passive immunity for shingles. So you have less kid with chickenpox and you have less immunity for shingles. All right. So if I keep on rolling here with you guys, when do you think will be an ideal time to get an antibody test? I think now is a great time. I think now is great. Quercetin's excellent. Yep, I like that as well. How long can you take vitamin C to bowel tolerance? I mean, don't do it long. Just get it up there and then back off and then get your stool solid. The goal isn't to keep on giving yourself an enema every day with high-dose vitamin C. Do you recommend oregano oil in addition to C and D? Oil of oregano is great. I probably wouldn't be on it long-term because it can knock down a lot of good bacteria. I'd probably save it more during an acute phase. What do you suggest for shortness of breath? No COVID, but breathing is slightly off with a low-carb diet for some reason. I mean, you could always do some vitamin C and some NAC. If there's any mucus, the NAC and the glutathione will really help dry up those mucous membranes. Excellent. Glad you're liking it, Joanne. Excellent. Do RX any prophylactic elderberry or echinacea? Yep, that's great too. Elderberry is great. Echinacea is good. Those are all going to help with your immune system as well. Let me hear it. When you're done with corona, does Mimosa pudica kill blastohominus? Mimosa pudica, otherwise known as Morinda, would also have a good effect against blasto for sure. Absolutely. Very good. All right, guys, I think I answered all your questions. Hope that makes sense. I may come back this weekend and do a live Q&A over the weekend. Let's see if I have time. And I look forward to being with you all. And if you enjoy the content, make sure you give it a share. Share it with friends and family. Put your comments below. Make sure you're subscribed and you hit the bell for great notifications. All right, guys, take care. Have a fabulous weekend. Bye now.